Hi everyone, welcome back to my channel. So today I have a 1-year myomectomy update. If you don't know or you are new to my channel, I suffered with fibroids for about 7 years, and 2021 it got to the point where I had to make a decision on what I was going to do to resolve the issue, and so I ultimately decided to have surgery. And I had the myomectomy June 7 of last year. So we're definitely at the year mark or over the year mark at this point in the month. So just wanted to come and update you on what's been going on with my uterus in general. I want to say since having the surgery, anything that has came up since then, and all those lovely types of updates that if you are looking into this surgery, about to have it, or you have fibroids, what to expect that may or may not happen, because everybody's case is different, everybody's symptoms can be different, and everybody's outcome can definitely be different. I would start with this year started great. I want to say until about February. Now, since my surgery, I've been doing well. I had no back pain, I had no cramping, I had no symptoms. Until February of this year is when I started having cramping in my pelvic area. And the first thought that I had was, maybe this is just my period. You know, my period does give me pain and cramps, but it doesn't usually happen until maybe the week before, or maybe like into day 2 or 3 of the period, I want to say. So it wasn't that time, I wasn't on my period or anything, and I started having really bad cramps. That reminded me of when I had my fibroids, and I started to panic, like, oh my God, maybe they're coming back, because unfortunately you can have this surgery and the fibroids can come back, and the doctors do stress that to you when you're going through the initial process of trying to figure out, should I get the surgery, should I not, and all those types of details. So I scheduled an appointment for my gynecologist. And this gynecologist is new to me. I decided to go to a new gynecologist. So she ordered that I have an ultrasound, because I did tell her, look, I had surgery last year. I don't know if I'm having complications or something, but this is not feeling okay with this cramping. Also, it was giving me lower back pain. So it was giving me all the symptoms of fibroids, lower back pain, cramping, severe, just achy pain type of feeling in your uterus. So in March, I had my ultrasound, and on that ultrasound, it showed that I had cysts. Cysts are not new to me, so I've been having them with the fibroids, I want to say. I mean, when you have fibroids, you have a lot of ultrasounds, and cysts did come up in some of those ultrasounds that I had with the fibroids. So it wasn't like an uncommon thing. And cysts with women are definitely common. I mean, it's a part of the reproduction, system and what we go through with ovulation. So it's nothing that should be very alarming when they tell you you have cysts on an ultrasound. But if you have pain or you're having a symptom with it, that's when they start to feel like, okay, let's look a little bit deeper into this. So she tells me that I have 2 cysts on my left ovary that are about 4 to 5 centimeters, and they are filled with fluid. So she told me I had those on the left, and then there was 1 cyst on the right ovary at the same time. That was about, I want to say 2 to 3 centimeters, So that cyst was much smaller than the two on the left ovary. And when she was telling me this, I could understand why, because it did feel very crampy on my left side of my uterus. Like that's where I was feeling the most achy pain, I want to say. And that's where the two big cysts were on that side. So that definitely made sense to me that, okay, so it's the two cysts that are about 4 to 5 centimeters that are causing the pain for me, because the one on the right, I don't necessarily feel it. It's not causing me as much pain as my left side. So her recommendation at that time was, let's monitor the cysts. Let's order another ultrasound about 6 to 8 weeks, because they're not going to necessarily jump into surgery and be like, oh my God, we need to do something, we need to go in and take it out, unless it's giving you a major issue. And with cysts, they can resolve themselves, so it's not something you necessarily have to be worried about unless it's causing another major issue or if it erupts. And she did warn me about that she would only feel like it was, surgery was something to look into if they were to burst and cause other issues. But as long as they, maintain themselves and resolve themselves, she wasn't really concerned. But she did want me to be monitored and see, as the month progressed, how do the cysts react. So also within the ultrasound, they found a fibroid. And the fibroid is 1.3 centimeters, I believe. So it's a fairly small fibroid, but it's calcified. So my first reaction was, okay, is this a brand new fibroid or is this a remaining fibroid? Because I know when I was doing my research and, watching other women's videos here on YouTube about their surgery, I know some of them were saying that the doctors couldn't necessarily get all of the fibroids that they had. Like some of these women had like 20 fibroids. Luckily, I only had 5. Only 5 that showed up on the ultrasound that I had before my surgery that the surgeon found to be the ones that he was going to go in and take out, So when she told me the size and that it was calcified, I was thinking, I think that may be a remaining fibroid because it's so small, maybe it wasn't a major fibroid that they wanted to take out, and maybe they didn't necessarily see it. I mean, when you're having surgery, they only have so much time to go in there and do what they gotta do and then stitch you back up, So I was kind of like, I don't know. For me, I think it's a remaining fibroid. I could be wrong. I don't believe it's causing me any pain or issues. I believe the pain was definitely coming from these cysts. So April comes, I do another ultrasound. This ultrasound reveals that the 2 cysts that were causing me the most cramping and back pain have now resolved themselves. They're now gone. But the cyst on the right ovary is still there, it's still present. And I did tell her I felt better. I didn't feel as achy and crampy as I did when I first brought up the issue to her. So she decided, okay, let's still monitor this and see what's going to resolve or if it's going to give you any issues with the one still remaining on the right ovary, which still was 2 to 3 centimeters. And of course, my fibroid that showed up in the last ultrasound was still the same size. It did not grow any bigger. It did not get any smaller. It was still 1.3 centimeters. So then this month, June, I had another ultrasound. And this ultrasound revealed basically the same thing, that the right ovary still has that cyst present, still about the same size, and my fibroid is still there, still the same size. So she came to the conclusion that this is just part of ovulation. She doesn't feel like it's anything to worry about. These are functional cysts, and it's just a part of, you know, what happens when I go through my ovulation every month, you know, and it's really nothing to worry about at this point because we've been monitoring it, all of the cysts for the last 3 months, and at the same conclusion with the last 2 ultrasounds. So her suggestion to me was, let's put you on a low estrogen birth control. Now, I have not been on birth control since my early 20s. And honestly, I didn't like being on birth control at that point in my life. I felt like it did make me more bloated. It just made me feel not great. So I'm not a big pill taker anyway, to be honest with you. The only way I'm taking a pill, even if it's for a headache, is like it's got to be a major severe migraine or something. Like, I have never been the type of person that, you know, I get sick and then I'm running to take NyQuil or something. You know, I've always tried to tough it out first, but if it gets to the point where I can't tough it out and I need something, then that's like the last resort I will go to. Like, even with my surgery, they always prescribe you Percocet and 800 ibuprofen Motrin, right, for the pain. And I always, you know, don't take the Percocet, especially when I'm at home. I'll take it while I'm in the hospital and being monitored by nurses, but I never take it at home. Like, I just refuse. It just makes you feel very loopy. I hate the feeling that Percocet makes you feel. So I always just resort to using the 800 milligram ibuprofen. Even that, like, I could still be in like some type of pain, like even, you know, not severe, but it's kind of achy. For me, I would rather deal with the achy pain than take the medication. I don't know. It's just, that's just always been me. It sounds probably crazy, but I don't know. I'm just not a big let me pop a pill person. She did prescribe the birth control. She did tell me it will help, you know, with the cysts, since they're definitely forming because of ovulation. It'll help suppress them from forming. She went into telling me that it'll help just my overall period. I did tell her I'm still experiencing heavy bleeding. Now, the heavy bleeding isn't as extreme as heavy bleeding with fibroids. I will tell you that. The heavy bleeding, I feel like, is day 2 and 3. And then after that, it's definitely smooth sailing. My period used to be about 5 to 6 days with fibroids before I had the surgery. And now after surgery, my period is about, it's about 3 to 4 days, I want to say. 4 days definitely being the max. And maybe like 3, and then like day 4, I'm spotting or something like that. But day 2 and 3, I just feel like I'm still bleeding significantly heavy. But it's not like flowing like how it would flow. Like, I felt like with fibroids, it would flow like running water sometimes. Like, it was a lot. Like, I don't know how to explain it. Like, if you have fibroids, I feel like you understand what I'm saying. You know, understand? It was just a lot of blood every month that I was losing with them. Definitely not losing as much as I used to. It's definitely decreased, but I feel like it hasn't decreased enough for me to feel like I'm not a heavy bleeder, if that makes sense. So definitely, she told me being on the birth control would help with that. She was basically telling me that it's a normal thing for women to be on birth control, not just as a, you know, I'm trying not to get pregnant, like a contraceptive. It's just not only being prescribed to women just so they don't get pregnant. She was explaining to me that she has a lot of patients that are going through menopause, that are going through a lot of other issues that birth control also helps with. which I kind of didn't realize that. You know, when somebody tells you you need to go on birth control, the first thing you're thinking is like, oh, you're trying to prevent me from having children, of course. But the way she explained it to me, that, you know, even though I'm about to turn 40, you know, I haven't reached the age of menopause or anything like that, but I can be on birth control up until that point, and it would be perfectly fine for me to do that, and it would help with my periods and just my overall uterus in general. I can definitely do the birth control, maybe see how it makes me feel. It is a low estrogen birth control, maybe do a month of it and see how it goes, how my body responds to it is what maybe I'm looking at right now. But it doesn't necessarily make me comfortable that the resolve is I may have to be on this medication until I reach menopause, you know what I'm saying? So I'm not happy about that at all, but we'll see how this next month goes, because I need to start it with my next period is what she was telling me. And so yeah, so basically right now I feel great. I don't have any cramping or I have lower back pain. It's nowhere near how it felt when I had the 2 cysts on the left ovary. It's a little achy, but it's like it comes and goes. It's not, I feel like when you have fibroids or cysts, the achiness in your back is a constant achiness that you feel. As far as my incision and my scarring, I feel like my scar has definitely keloid, and I didn't put anything on my scar or my incision, you know, while I was healing. I did not do any of that. I didn't do any of that with my 2 C-sections either. I just allowed my incision to heal as is. And with the 2 C-sections, it did well. It did not keloid. But I noticed with this surgery, it definitely keloid. I don't know if that's because I had the staples. I didn't have staples with the 2 C-sections. That may be the issue. Or maybe just from me having so many surgeries, this was definitely number 3. I was upset about me still having a pudgy type of stomach. You know, even after the surgery, after all the healing and stuff like that. I just feel like it's just a form of fat that is just sitting there that I need to, you know, definitely work on, which I have been. I definitely made a video about my journey to, you know, turning 40 and getting my body in the shape that I want it to be. So I've definitely been working on that. I've been working out 4 times a week. And I'm just going to be honest. When your core is not where it should be, you feel it when you're working out. And I feel like my core is definitely weak. It's not, I notice it's not as strong as it used to be. And definitely that is because I've had 2 children. I've stretched my abs out several times, you know, even with fibroids. My core it's like, it just feels like it's taking a long time for it to get its strength back and to feel and get back the muscle needed to form the type of flatness or the stomach that I'm looking for. Definitely my health is important to me, but for me, I feel like, yes, my health is important to me. I want to be healthy. I want to do what's right for me though, because I feel like, you know, taking a pill and doing certain things is not always right for everyone. You know, some people take a holistic point of view of healing things, and I've definitely been interested in trying to go that route too, to see if that makes a difference. Of course. So I hope you guys enjoyed this video, and I thank you so much for watching. Take care. Bye guys.